tight on the landing ground.
Thank you for joining us. You are listening to A Radio, and this is the Morning Moment. Please click on the follow button on Spreaker.com. Listen to this clip from Special Report talking about a reduction in healthcare access in rural America. But they are missing the big picture, maybe by accident, maybe not. However, by reducing services over time, gradually people are being nudged out of rural environments, that's Cass Sunstein, into a more manageable urban one. Perhaps it may have slipped your observation, but this is exactly, and I say exactly, what Agenda 2030 seeks to do. Depopulate North America. That's rural North America. But you may be forgiven if you missed it. Most of us do. But it's happening right now, right under your nose, and in plain sight.
Most experts agree the new legislation would not turn around the deteriorating condition of rural health care. From Denver, correspondent Alicia Acuna tells us what's wrong and why.
For more than 2 years, this once busy, fully stocked medical clinic in central Colorado has sat empty.
Park County has no hospital, no urgent care, now no primary care.
Dr. Catherine Fitting worked here until retirement and is trying to help her rural community find a physician to run the only clinic in the county with a lease of $1 a year. So far, no takers. It's a hindrance for folks like Army veteran Jerry Ferris and his wife.
He could get his care right here in our town if we had a place for him to get it, instead of driving 60 miles one way.
It can take Park County residents up to 2 hours to get to the nearest physician.
We're actually seeing declining life expectancies in rural America.
The National Rural Health Association says remoteness and economic factors make it hard for medical facilities to survive.
We're expecting a quarter of the nation's rural hospitals to close within the next decade without local, state, or federal intervention.
On average, rural regions have only a third the number of physicians as urban areas, according to the NRHA. You can hardly blame the doctors who mostly practice in big cities. According to the Association of American Medical Colleges, the average med student debt upon graduation is close to $190,000. Small population centers are no match.
When people look at the demographics and the ability to generate an income, they don't see that they can do that.
The NRHA says the possible repeal of Medicaid expansion and the Republican plan to replace Obamacare would not help rural Americans who turned out in big numbers for the GOP last November.
Rural America put Trump into the White House.
Without doctors on hand, these small towns end up overwhelming their ambulance services. According to the NRHA, in many rural communities, EMS serves as the access point of care. Chris.
Alicia, thank you.
You can find more at aradio.wordpress.com, where you will find links to us on Twitter, Facebook, Instagram, iTunes, Gab, and email. We are continuing to reach out to you, so please pass on the links. Please click on the follow button on Spreaker.com. You can listen to all my morning moments on Spreaker.com under A Radio. That's EHRADIO, A Radio. And please click on the like button. You can find all my podcasts and all my morning moments at aradio.wordpress.com. Click on the Morning Moments tab.